I couldn't run if it was an emergency. Well, also I can't ride a bicycle, although I can sort of halfway dance a little bit with my wife. I have to be real careful because I can't pick one of my legs up as I shuffle and do the old-fashioned waltz. I can't carry my grandchildren up the stairs. I can hold them in place, but I have to be careful walking with them because I don't have good enough balance with weight in my arms to be safe. West Nile virus changed my life forever. I will never be normal like I was before I got sick. I'm thankful to be alive. I'm doing great, but I'm able to do half of what I was able to do before, and I'll never be back to where I was.
Until this summer, probably most of us in Dallas County had never heard of West Nile virus. But for the first time in 45 years, the city of Dallas is contemplating aerial spraying for West Nile virus. Why? Because we've had 693 reported cases in the United States, half of them reported in Texas, along with 12 deaths alone in Dallas County. So who better to talk about West Nile virus than somebody who's actually experienced the disease? Tonight, we're welcoming Dr. Don Reed into our studio to talk about West Nile virus. Don, welcome.
Thank you very much, Dr. McCoy. I appreciate the opportunity to talk about West Nile virus. We are currently in the midst of a public health emergency, a disaster for Dallas County. The most cases we ever had in the past was 104 in 2006. Then we had 0 cases last year, 2 the year before, and now all of a sudden we have 217 cases in Dallas County as of today, with 10 or 12 deaths, whatever it is so far. West Nile virus is a virus that's carried by birds and transmitted from birds to us by the mosquito. The female mosquito needs blood to fertilize her eggs, so she bites the bird, and we happen to be walking by and we're the unwitting recipient of another bite, and therefore we get the virus from the birds. But the large birds, blue jays, crows, mockingbirds, and robins are the carriers of the disease.
But Don, we're nowhere close to the Nile. So where does the word West Nile come from?
Well, the West Nile virus comes from the West Nile part of Africa. Started out in Africa many years ago, came to the United States in 1999 in New York City. The strain we have here is more virulent than the strain in Africa, and appears to have come through Israel and Romania to New York City. So it appeared in the United States in 1999 in New York City, appeared in Texas in 2001.
And they're telling me today that 50% of the mosquitoes in Dallas County are carrying the virus?
I don't know what the count is today, but at the peak it was 60% of all the mosquito traps. So they get a bunch of mosquitoes in a trap, and instead of figuring out which one's infected, they grind them all up, put them through the machine, and either there's West Nile virus in one of those mosquitoes or more of them or not. But typically we would get up to about 30, maybe 40% at the peak in past years. This year we got up to 60% of all the mosquito traps being positive.
Which means if you walk outside and you get bit by a mosquito, there's a decent chance it could be a West Nile mosquito.
There's an excellent chance because almost every zip code in Dallas County had positive traps.
So what happens? So what happens if you get West Nile virus? What happens? What kind of symptoms do you have?
Well, it's very interesting. We all get the flu. You know, you have fever, some muscle aches, and you feel bad for a day or two or 3 and goes away. Usually doesn't keep people from going to work. This is the flu times 10 or times 100.
So could people have like a subclinical case and not really know that they had West Nile?
In fact, most people do. 80% of all the West Nile virus cases are asymptomatic. People get the disease, they never know they had it. They might have thought they had a cold or something, but they never thought they were really sick. So 80% are asymptomatic, 20% have enough symptoms that they end up knowing they're sick. 1 out of 150 get the neurologic symptoms with encephalitis, meningitis, and polio-like paralysis.
So what is that, though, when you say encephalitis? Tell me what that means exactly.
It's like putting your brain on a skillet and frying it. So when that happened to me, which we may go through later, but when that happened to me, by the time I ended up in the hospital, both legs were almost completely paralyzed. My arms were mostly paralyzed. I was sleeping 23.5 hours a day. I couldn't talk. I couldn't hear. I couldn't write. I couldn't turn over in bed. you know,
And this is from a mosquito bite from Dallas County.
exactly. I got this mosquito bite walking in my neighborhood for my health. No good deed goes unpunished. So my wife and I were out walking. I got bitten, and some days later I came down with the disease. So when it first started, I had done a colon resection that day. I went home from the hospital and I was unusually tired, so I went to bed. This was on a Tuesday. Went to bed, got up Wednesday morning, and I just felt terrible. I thought, my gosh, if I don't start feeling better soon, I'm going to have to go to the emergency room. Well, fortunately, I felt a little better, so I went to work. I typically do a few colonoscopies Wednesday morning. I got through my colonoscopies and went home, went back to bed. Thursday morning, and I slept all night. Thursday morning, I got up. I still felt like I was dying. If low-grade fever, your muscles ache and ache and ache. You feel like you're carrying a backpack with 1,000 pounds of bricks in it. It's just god-awful. You just feel like you're going to die. But there are no localizing symptoms. No sore throat, no runny nose, no cough, no diarrhea.
And no typical
No,
meningitis.
nothing.
You weren't having like a
nothing.
headache.
You just feel like you're going to die. So on that Thursday morning, the second day, I ran into one of my infectious disease colleagues at the hospital, and I told him what was going on. I said, "Could this be West Nile virus?" He said, "Well, yeah, it could be." He said, "How long have you had it?" I said, 2 days. He said, "Well, you have to have it 5 days before we can test for it." I said, "But I'm leaving town in 2 days to go to Indiana to my daughter's doctoral organ recital." He said, "Oh, go ahead." He said, "If you feel bad when you get back, we'll run some tests, see if that's what you had." So I got sick Tuesday. I saw him Thursday. Saturday, I flew to Indiana. By that time, I was sleeping 20 hours a day. I flew with my other daughter up there. By her recital on Tuesday evening, I slept all day. I got up, got dressed, went to the recital, videotaped it like the dutiful father, went back. We had a little reception for her. I made it through about 30 minutes of that, and then went back to bed. Every day after I got up there, my wife wanted me to go to the emergency room. I kept saying, "They're not going to do anything."
Now,
They're
wait
gonna
a
send
minute.
me
You're
home."
a doctor.
Yeah.
And you had been to a doctor, and still nobody
Well,
had really
casual.
confirmed, or you had
Yeah.
made the diagnosis. So it's hard to know what was going
I
on.
made the diagnosis on myself because there wasn't anything else that made any sense. So I wouldn't go to the emergency room before her recital because I knew they were just going to send me home. So the morning after her recital, I tried to get out of bed and I found out my legs were paralyzed. We were in an upstairs bedroom in a motel. So my 2 daughters helped me down the stairs and took me to the emergency room. I told them I was a doctor and I thought I had West Nile virus. Emergency room doctor said, "Oh, well, if you have West Nile virus, we'll have to do a spinal tap." And I said, "Yeah, go ahead." 8 hours later, I was still in the emergency room. She thought she could give me some IV fluid and get this gomer out of her emergency room. She didn't believe I had West Nile virus and didn't do a spinal tap. And so my wife went up and said, "Well, when are you going to have a bed for him?" She said, "Oh, I'm not sure I'm going to admit him yet." My wife, who's a nurse, said, "Yeah, you are." Said, "He's sick. This is not him."
Because you couldn't walk.
I couldn't walk. But the ER doctor was hoping she could get me out the door anyway. So they admitted me, and within a couple of hours I was in ICU. So by the next morning I couldn't move my legs. I could hardly move my arms, and I couldn't talk. I was sleeping essentially all day. My family kept poking me and saying, "Wake up, wake up."
So did they start treatment for West Nile virus at the time? Or?
Well, the treatment is just supportive. You give IV fluids, you give antibiotics if you think there's something else going on. You do all the tests to make sure it's not herpes encephalitis or some other problem that you didn't recognize. But it's just purely supportive. With neuroinvasive disease like that, 5 to 10% of people die.
So when you mean neuroinvasive, you mean the West Nile
Self-
virus actually gets in your brain and starts
Yeah.
attacking that area?
Yeah, it's in the spinal fluid. So you get it out, you get it on the spinal tap.
So you made a statement to me before we started about the treatment for West Nile viruses.
Is rehab. Because
There is no treatment.
There is no treatment. There is no specific treatment for the virus. You can't give Tamiflu or something like that. That doesn't work. So it's purely supportive care. You keep the blood pressure up. You know, I'd sit there and watch the monitor by my bedside, and I'd be hypertensive one time. The next time I'd be hypotensive. My pulse would be 120, then it'd be 40. It was just bouncing around.
So the treatment sounds like to me is prevention to some degree.
Absolutely.
So prevention. Don't get bit by mosquitoes. So there's some
Absolutely.
things you could do.
Right.
You could give me some examples of how you could avoid getting bit other
So
than
the way
just
you
leaving.
can decrease your chance is to not go out at dawn and dusk. If you do, because that's when the mosquitoes are out. If you do go out at dawn and dusk, wear long sleeves. A little hard to do when it's 105. But if you don't wear long sleeves, you better put DEET on, because that's the only thing.
And DEET's an insect repellent.
Insect repellent. You know, there are organic kind of insect repellents, but they don't last very long. So DEET's what you have to use, even on children. And drain standing water in your backyard. The house mosquito, the Quinque fasciatus mosquito that carries the West Nile virus in our area, and it's different mosquitoes around the country, but that one in our area breeds in 2 drops of water. So not the big pools of rain when we have rainstorms. It's the 2 drops of water sitting in the overturned bottle cap or the old tire or flower pot or bird feeder or pet dish in your backyard. That's where they breed. So you need to get rid of all that water and be careful when you go out at dawn and dusk. Use DEET, wear long sleeves.
And there's no vaccination for West Nile?
Oh, there is, if you're a horse. I vaccinate horses all the time. It's a very common disease in horses. In fact, one of the patients in my West Nile support group was diagnosed by his veterinarian on the farm. The guy said, "I think you've got West Nile virus." Sure enough, he did. So there is no treatment for the disease. Prevention is the key. And currently, locally, you know, the trucks going around spraying insecticide are what we've always used, and that's worked fairly well in previous years. This year, we've had such a high number of positive traps that mosquitoes beat us at our own game. There were more mosquitoes than we had trucks to knock out. So our regular defenses became overwhelmed, which is why the issue of aerial spraying has come up.
Let's talk about that. This aerial spraying, it's the first time in 45 years. I mean,
1966.
You think of aerial spraying, you think about looking at black and white health movies in health class. I mean, it's not a common thing for people these days, as sensitive as people are to talk about the environment and all that. Is it safe? I mean, what is aerial spraying?
It is safe. They use the same insecticide from the air that they use in the trucks going around spraying in front of your house. The difference is they use a lower concentration from the air than they do from the ground, ironically. So people aren't concerned about the truck coming through down their street, but they're very concerned about the same thing being dropped on them from the air.
And I guess the kicker is that they can cover a widespread area more efficiently.
Yes.
And so you can lower the density of mosquitoes.
The problem with the trucks, in addition to the fact that we got overwhelmed and didn't really have enough trucks to keep up with it, is that a lot of alleys they can't go down. So you get the front yard, you don't get the backyard, which is where you're more likely to have the mosquitoes. Foreclosed homes that have a swimming pool full of green water and mosquitoes, by law they can't even throw insecticide pellets over the fish into the swimming pool. So the aerial spraying will get all that stuff that they can't get by the ordinary means.
And the doctors, are they in favor of aerial spraying?
Aerial spraying came up from a committee of a bunch of infectious disease doctors in Dallas that was meeting with the public health department. They decided that this was way out of hand and that we needed to consider aerial spraying. They made that recommendation informally to the health department, but they also made it to Rick Snyder, the president of the Dallas County Medical Society. Rick convened a meeting of the Community Emergency Preparedness Committee. We had a conference call. We talked about all the data, what was going on. 13 people on the committee. We unanimously voted to recommend aerial spraying. That recommendation went the next day to the Board of Directors of the Dallas County Medical Society, and they voted unanimously to recommend aerial spraying. So between the infectious disease doctors who had voted unanimously, the Emergency Preparedness Committee voted unanimously, the Board of Directors voted unanimously, I think the total was 38 doctors in leadership positions in Dallas County all voted unanimously that this is what we ought to do. So that recommendation was made to Clay Jenkins, the county judge, who, as the Homeland Authority, has the political power to declare an emergency. So he's the one that declares it, not the whole county commissioner's court. He individually does. Likewise, the mayor of each city has to declare an emergency and authorize the aerial spraying. We're under home rule, so even though the county decides to do it, the cities within the county that want to be sprayed have to agree to it before they'll be sprayed. Most of them in the target area agreed.
Well, Don, sounds like it's been 5 years since you went through this ordeal.
7 years.
So 7 years. So how are you? I mean,
I'm
what
great.
What happened?
I'm a lot better.
How are
than
you doing
I'm
with
a
that
lot
disease?
better than being dead. I still wear braces on both legs, and you may want to show that at the end of this. And I will always have to wear braces. I don't have to wear them around the house, but anytime I go out and do anything, I have to wear braces because of the polio-like paralysis that I got with the disease. So I have, dorsal horn cell damage just like polio. So my muscles work, but the nerves don't tell them to work, so they wither up. If I do too much with my legs, then I have terrible cramps at night. And if I do too much, then my legs will actually get physically weaker. And sometimes it takes 2 or 3 weeks to recover from that. Early after the disease, one day in physical therapy, I did too much. It took me 3 months to get back up to where I was that day when I did a little too much in physical therapy. So I have to wear braces. Because I have to wear braces, the residual weakness in my legs is such that I can't stand at the operating table to do abdominal surgery because you have to stand in funny positions. And my legs would give out. I'd fall in the wound after about 2 minutes, and I thought that was going to be bad advertising, so I decided I shouldn't do that. So I had to give up abdominal surgery because of the disease. So I'll never be able to do abdominal surgery again, which cut out half my practice. I was working 88.7 hours a week when I got sick, not atypical for a surgeon. I'm now working 35 hours a week, and I probably couldn't work more than 40 or 45 hours a week if I wanted to.
Well, we're glad, though, that you took one of those hours to come down here and talk to us.
Well, thank you.
And I know that the people that are watching this video are going to learn a lot about West Nile virus. Hopefully they can avoid getting infected with it, and hopefully they can learn more about aerial spraying and the benefits that we have to maybe eradicate part of that problem here in Dallas.
Fortunately, people have become aware of West Nile virus in Dallas County. The doctors have. When I got it, nobody knew anything about it, which is why we developed a support group, because everybody go to the doctor and say, could this be West Nile virus? And say, no, well, it turned out to be West Nile virus. Now, in Dallas County, if you get sick, it's very likely you're going to get tested for West Nile virus. So we're very happy that the medical community has had the experience to become aware of the disease and test people for it.
Thanks, Dr. Don Reed, and I'm Dr. Dan McCoy. Thanks for joining us for this web presentation of West Nile virus. You can find more information about the disease on www.texmed.org or on www.dallas-cms.org. Thank you very much.